Welcome to Impact Signals, social impact at the scale of AI. I'm Charlie.
And I'm Sarah.
It's Wednesday, February 25th, 2026. This is episode 13. Today's theme, field deployments and case studies. Madagascar just got hit by a Category 5 cyclone, and for the first time in history, a humanitarian agency pre-positioned cash in households before the storm even made landfall. Let's start with that story, because it's genuinely unprecedented. The World Food Programme published its full after-action report today on Cyclone Gezani, and what happened here is a milestone for anticipatory action globally.
So, the backstory. WFP has been building forecast-based financing systems for years. The concept is that if a model predicts a disaster is coming, you trigger transfers before impact, not after. That's been proven in drought contexts, but cyclones are much harder. The track uncertainty is higher, the timeline is compressed, and you have maybe 72 hours to act.
So what happened with Gezani?
When Gezani was still 100 kilometers offshore, sustained winds at 166 kilometers per hour, WFP's trigger threshold was met, and they immediately began distributing cash before the storm made landfall.
The numbers here are specific, $54.19 per household, which is equivalent to a 2-month food ration, distributed to 3,150 households, plus early warning alerts sent to more than 5,000 people in the highest-risk coastal zones.
And the cyclone did not cooperate. Gezani made landfall on February 10th and 11th with sustained winds of 180 kilometers per hour, more than 400,000 people affected. This was not a near-miss scenario. It was a correct hit.
So the question is, what difference did that pre-disaster cash actually make?
Families who received transfers before landfall were able to purchase food, secure shelter materials, and move livestock. They broke the post-disaster destitution cycle at the front end instead of waiting for emergency relief to arrive afterward, which is always slower and more expensive.
And WFP is now pushing to expand this from a pilot to a full national program for Madagascar's cyclone season. The key lessons that came out of the report? The sub-72-hour trigger window is actionable, and mobile cash transfers outperform food vouchers for deployment speed. Any organization operating in a cyclone-prone region should be reading this trigger model carefully.
It's the operational proof of concept that cyclone anticipatory action works. Drought AA has been running for years. Now the methodology is validated for cyclones too.
Staying with WFP, the WFP Innovation Forum published detailed case studies this week for 2 AI systems that are now operational at scale across their entire operations. These are not pilots. These are running globally.
The first is called ADAD, Anomaly Detection for Assistance Delivery. It's WFP's flagship anti-fraud system, and it has 2 modules. RAD, Registration Anomaly Detection, flags ghost beneficiaries and duplicate registrations using machine learning. And TAD, Transaction Anomaly Detection, monitors payments in real time for patterns that human auditors simply can't see at volume.
WFP's funding situation makes this critical context. The agency took a 40...
That's not a projection, that's operational savings. And the supply chain planning component has generated $11 million in efficiency gains to date.
What I find significant is what these 2 systems together represent. WFP has moved beyond logistics optimization, which is where most humanitarian AI started, into integrity assurance and conflict anticipation. That's a maturation of the field. And both systems are being shared with partner agencies. If you're at UNHCR, ICRC, or a large operational NGO, you should be requesting access through WFP's Innovation Hub.
Third story today, and this one is about funding the evidence gap that has plagued AI health deployments for years. 3 of the world's largest health philanthropies announced the EVAH initiative this week, Evidence for AI in Health, $60 million over 3 years.
The problem EVAH solves is specific. Hundreds of AI health tools have been deployed across low and middle-income countries. Almost none have been rigorously evaluated in the actual settings where they're used. A tool that performs at 94% accuracy on a clean dataset in a U.S. hospital may perform much worse in a rural clinic in sub-Saharan Africa, where power is intermittent, data quality is inconsistent, and disease prevalence profiles are completely different.
And who's behind this?
Gates Foundation, Novo Nordisk Foundation, and Wellcome are co-funding. The scope covers prediction models, computer vision tools analyzing X-rays and ultrasounds, large language models for clinical decision support, and multimodal AI combining vital signs with imaging data. But the structure is what makes this different from a typical grant program.
Walk me through that.
Countries lead their own evaluation designs. The evaluations are done by the communities actually using the tools, not by a lab that then exports findings to the field. No lab-to-country mismatch. Wellcome's Charlotte Watts put it directly.
Only by working in partnership and investing in rigorous evidence generation and learning will we be able to support decision makers and services to meet the needs of the communities they serve.
The call for proposals is open now. Health NGOs, ministries of health, UN health agencies, if your organization is deploying AI health tools in low or middle-income countries, EVAH is the infrastructure that answers the question, does this actually work where we're using it? Apply at welcome.org/EVAH. Africa-wide now. The African Development Bank and UNDP published their full implementation roadmap this week for what they're calling the AI 10 Billion Initiative, a framework to mobilize $10 billion in AI investment across Africa by 2035.
The scale targets are significant. $10 billion in investment, 40 million new jobs, $1 trillion in additional African GDP. But what matters more than the headline numbers is the philosophy behind the initiative, which is sovereign AI capacity.
Meaning what specifically?
Meaning African governments and NGOs shouldn't have to rely on external tech platforms or foreign corporate APIs when a disaster strikes. If a company shuts down a service or a conflict disrupts connectivity to cloud services hosted overseas, you lose your famine early warning system. Locally hosted AI for crop monitoring, flood prediction, and health triage can continue operating when external dependencies fail.
The roadmap focuses on 5 enablers: data infrastructure, compute capacity, workforce skills, AI governance and trust frameworks, and capital mobilization. And the first 2 phases are specifically data governance and local compute.
Both of which are directly relevant to humanitarian organizations right now. Practitioners working in Africa should be engaging with the AfDB's investment roadmap process to make sure humanitarian use cases are built into the national AI strategies being designed today, not retrofitted later.
Story 5, and this is about the most battered health system in the world. WHO's Eastern Mediterranean Regional Office and PAHO, the Pan-American Health Organization, signed a formal agreement today in Cairo to jointly implement what they're calling the Resilient Hospitals Operational Framework.
The context here is stark. WHO EMRO covers a region that's home to more than half of all people globally who need humanitarian assistance, and it accounts for 40% of all attacks on healthcare worldwide. Hospitals, ambulances, health workers, 40% of global incidents in one region: Yemen, Syria, Gaza, Sudan.
So what does the framework actually do?
It applies an all-hazards approach across the full disaster risk management cycle: structural resilience, functional continuity, organizational preparedness. EMRO and PAHO will jointly build tools, run capacity programs, and coordinate resource mobilization. Dr. Hanan Balki from EMRO said it directly. Hospitals across the Eastern Mediterranean are under immense strain, and in too many settings, they are directly under attack.
The collaboration itself is meaningful. You have the most conflict-affected health region partnering with the most hurricane and earthquake-affected region. That's shared tooling practitioners in both areas can access and adapt. For NGOs operating in conflict zones, the framework gives you a standardized assessment you can use to evaluate hospital resilience before a crisis hits, not after. Story 6, a cautionary story that every humanitarian tech team needs to hear. This happened Monday. A major cloud provider confirmed that an internal agentic AI tool, a system built to autonomously execute maintenance tasks, deleted and recreated an entire cloud environment. 13-hour service disruption. The agent executed the destructive command on its own.
The provider initially described it as a human oversight issue with permissions, but what subsequent reporting clarified is that the AI agent autonomously issued the destructive command. There was no human in the confirmation loop.
And why does this matter specifically for humanitarian organizations?
Because humanitarian agencies are increasingly running cloud-hosted AI for famine early warning, refugee registration databases, disaster response coordination. If an autonomous agent failure happens during an active emergency, not a routine Tuesday, you could lose access to beneficiary data or logistics dashboards at exactly the moment you need them most. UNICEF's AI strategy, which was released just yesterday, specifically mandates human-in-the-loop workflows. This incident is a live example of why that mandate exists.
The practitioner action items here are concrete. Review your cloud service level agreements for any agentic or autonomous maintenance tools. Make sure any AI system with write or delete permissions on humanitarian data requires explicit human authorization. And consider hybrid architectures for your most critical systems: active disaster dashboards, beneficiary registries, so you're not fully dependent on a single cloud environment.
The principle is simple. AI recommends, human authorizes all destructive or irreversible actions. That's the baseline. Don't wait for your own incident to implement it.
Final story today, out of South Asia. ITU's AI for Good team published this morning on Nemo Care Raksha, an AI-powered wearable developed by a startup out of IIT Hyderabad that monitors newborn babies for early signs of distress in resource-constrained hospital settings.
Neonatal sepsis and respiratory distress kill thousands of infants every day in settings where nurse-to-patient ratios are stretched and specialized monitoring equipment is scarce. The standard solution, hospital-grade ICU monitors, is expensive, complex, and requires infrastructure that most district hospitals in South Asia or sub-Saharan Africa simply don't have.
So what does NemoCare actually do differently?
It's a non-invasive wearable sensor. No needles, no ICU infrastructure required. It runs continuous hemodynamic monitoring and uses predictive analytics to identify early digital markers of distress before symptoms become clinically apparent. One nurse can monitor multiple newborns simultaneously through a risk-prioritized dashboard, and it's designed to plug into existing hospital infrastructure, no custom IT installation.
The ITU AI for Good Innovation Factory India 2025 is what put them on the radar. That's a competitive vetting process. The company is led by Manoj Sankar and incubated at IIT Hyderabad's Center for Healthcare Entrepreneurship.
What makes NemoCare a template for the field is the deployment logic. The AI is useful specifically because it works without specialized infrastructure. For pediatric NGOs and maternal neonatal health programs operating in districts without ICU capacity, which is most of South Asia and much of sub-Saharan Africa, the model is AI plus low-cost hardware plus clinical decision support equals deployable without full hospital infrastructure. That's the combination that actually works in the field.
Before we close, a few calendar items worth tracking. The EVAH call for proposals is open now at welcome.org/EVAH. $60 million available. Priority for teams already operating AI health tools in primary care settings. Google.org has 2 impact challenges running. AI for Government Innovation closes April 3rd, up to $3 million per organization, and AI for Science closes April 17th, focused on climate resilience and disease surveillance. If your organization has technical capacity and is working in those areas, both are worth a serious look.
And for practitioners building humanitarian tech or tracking AI in crisis response, the Action on Disaster Relief Conference is March 11th and 12th in Panama City, with IFRC and UN procurement matchmaking. NVIDIA GTC runs March 16th through 19th in San Jose with a dedicated AI for Good track. And IceCram 2026, the premier academic practitioner conference for AI and emergency management, is in Leiden, Netherlands in May, worth tracking even if submissions are closed.
That's a wrap on episode 13. I'm Charlie. She's Sarah. We'll see you tomorrow. Stay ready.